It's a frustrating situation. We know that when a patient wears and cares for contact lenses in a compliant manner, little to no adverse events will occur. But when people wear lenses significantly longer than they're supposed to, they can deposit significantly and cause corneal insult. Not only can contact lens abuse cause short-term insult, but can also cause long-term insult and harm to the cornea and ocular surface. This is an example of a patient who is wearing a monthly disposable contact lens for 4 months and storing it in a store-brand multi-purpose disinfecting solution. There is not only significant neovascularization, but also evidence of a stromal scar in the superior cornea. Additionally, there are infiltrates present at the leading edge of the neovascularization. It's interesting what the differences are between what our patients tell us they're using and what they're actually using. We ask patients to bring in their contact lens case, solution, and any other products they use to care for their contact lenses to their appointment. We're oftentimes surprised at what they bring in and are using. This is a perfect example of this. The patient was a new patient to our practice and was using Zymar, Systane, and FML Forte as needed for ocular redness and irritation. They were also using a sample size of Renew years after this was even being sampled to eye care providers. What was most shocking was looking at the expiration dates on all of the products which were long overdue. Fortunately, we have a number of options to help curb the noncompliance that occurs with our lens wearers. Daily disposable lenses help avoid the need to clean, and a number of studies have demonstrated daily disposable lenses are in fact the most compliant modality of lens wear. We've seen an evolution of lens technologies from hydrogel to silicone hydrogels, and now even the first water gradient contact lens design. Having patients bring in their lens care to the appointment helps easily facilitate the conversation about compliance and simplifying their lens wearing experience. But even then, some will feel that their current lenses are fine. This subjective response from lens wearers may cloud our judgment about their true wearing experience. So we've found significant value in attempting to objectify a patient's subjective response regarding their wearing experience. We simply ask them to rate their lens comfort about 5 to 10 minutes after placing lenses on their eyes on a scale from 0 to 10, with 0 being the least comfortable and 10 being the most comfortable they could picture their lenses feeling. Then we ask them to rank their comfort on that same scale about 5 to 10 minutes prior to removing the lenses in the evening. What's remarkable is the dramatic drop that occurs in a number of contact lens wearers. Knowing their true wearing experience facilitates a natural conversation about strategies to improve lens comfort, with one of those being transitioning to a daily disposable lens and ultimately improving compliance. It's important that we understand the true noncompliance that exists in our lens wearers and the deleterious effects that noncompliance can have to a remarkably healthy form of vision correction. Consider asking patients to bring in their current contact lens solutions to understand what they are in fact using. Understand the important role that daily disposables play in increasing compliance with our contact lens wearers, and also facilitate the discussion around daily disposables by having a better understanding of a patient's true wearing experience. Keeping these things in mind will increase compliance and help improve patient outcomes, which is ultimately why we do what we do. We hope that this has been clinically insightful.